Hello, everyone, and welcome to your Tuesday night education session. Tonight is a good one. We are going to be talking about running form and strength training. And I really cannot think of a better person to do that than Dr. Kacy Seynders. Dr. Kacy is with Precision Performance and Physical Therapy here in the Atlanta area. Precision Performance and Physical Therapy happen to also be the official physical therapy providers for Atlanta Track Club's elite team. So Kacy and my path cross frequently when she shows up here at Atlanta Track Club headquarters to work with some of our elite athletes. Kacy is the real deal, folks. She is a graduate of Emory University with her doctorate in physical therapy. One of the things I love most about Kacy is that she is an athlete herself. She's also a coach. She's participated in the Boston Marathon 4 times. She's participated in sprint and half Ironman events. She is the co-host for the More Than Miles podcast. I am certain that this is going to be a treat for many of you. So with that, without further ado, Dr. Seynders, I'm going to let you take it away.
Thank you so much for that introduction, Bob. That was so nice. Hi, everybody. This is awesome. I'm so excited about this turnout. This is one of my favorite presentations and favorite sort of things I do for the community is working with the in-training group. So I'm so excited, and I can't thank you enough for taking some time out of your evening to spend with us here. So without further ado, I'm going to go ahead and share my screen, get the presentation fired up here. And
Hello there.
Hi there, Leroy. I'm going to mute you.
Okay. All right, here we go. Sorry if my desktop stresses you out, because it stresses me out a bit as well. All right. All right, we looking good there, Bob? Excellent. Okay. So this is a little bit of a new presentation. The past few times I've done this presentation for the in-training group, I've talked exclusively about strength training and specific exercises, did a lot of exercise cueing and teaching, which we're going to do tonight as well. But I have a kind of really different sort of take and have remastered the presentation to include some very common patterns that I see in the clinic in terms of what I call running gait deviations. So maybe funky things we see people do while running that can lead to injury, if we want to put it in as simple terms as we possibly can. So here's our course map, if you will. So we're going to talk about some running form basics. So what do all these terms mean? What are we looking for when we're looking at someone's running gait? We're going to go over those deviations that I was talking about. So these are the most common things that I see and things that I think are low-hanging fruit, if you will, for us to improve via strength training and certain drills that can really make a big impact in your running and hopefully keep you injury-free. And then we'll finish up with a little bit of how to incorporate strength training into your routine. And there's just always these questions of what do I do strength training, right? So I hope to provide you some guidelines that help you incorporate strength training into your, not only your personal life, but your athletic life, and given the time and resources that you have. Okay, so big disclaimers here. So there is no perfect running form, and variation between individuals is inevitable. And just because we're going to talk over what might be ideal or what I look for as a physical therapist in runners who come and see me, who typically do have some sort of pain or problem, it doesn't necessarily, just because you have these things doesn't necessarily mean it's a bad thing. That's one thing I really want to stress here is I don't want anyone leaving this presentation being very worried about their running form. We're just going to talk over some very common things that we see. And if you're like, oh, yep, that's me, let's talk through it. If you have any questions, I want to leave plenty of time to the end so we can get to some more individual sort of trials and tribulations as runners, because I really believe this is very individual. Which is why I think the work that I do in the clinic is so valuable and a lot more nuanced than what I can provide here via presentation. But I really, really tried to do my best with what we're going to talk through tonight. So running form and running gait is probably the #1 evaluation tool I use as a physical therapist to figure out what's going on with a runner when they have an injury. It can give me a lot of information about muscular weakness, what might happen when that runner starts to fatigue and form starts to break down. And it just gives me this just such a large information for me to work off of in terms of what direction do we need to go in therapy. And another thing to note is, like I alluded to earlier, our running form is going to change within fatigue and duration of the run, which is why this strength piece is really important, because that's going to help with our resistance to fatigue. So here we're just going to talk about sort of basics running form. I'm going to keep this super easy. We could really get into the weeds with this because there is a lot of going on biomechanically, but I want to keep this relatively simple. So when I'm looking at someone's running form, I'm usually looking at, we're going to look at one side at a time, right? But in this diagram here, so I would start with looking at what we call initial contact. So when that foot first hits the ground. And so what I'm looking for here is, where is this foot in relation to the rest of the runner, right? So in terms of, are we hitting too far in front of the body, or are we right underneath ourselves, which we'll talk about what that means a little bit later. But I'm mostly concerned with, where is the runner hitting the ground? I'm less concerned with heel versus midfoot versus forefoot strike, depending on the individual's presentation. But I'm much more concerned of, where is that foot in relation to your center of mass? Then it's seen here as the drive phase, but down here it says mid stance. And so this is what I think about is when that foot directly passes underneath our body. So this is where this is an important part of running gait. And we're going to talk about this a lot because it's where we need the most muscular work. It's where our body is working the hardest to control everything before we propulse forward. So this is where most, I wouldn't say most, let's say this is where several problems can arise, and where we can, we'll see a lot of weaknesses come out here in mid stance, because that's where we need to be our strongest. And then we have kind of that push off phase, which is at the very end, or it's called propulsion here, or terminal stance. So that's right when that foot is leaving the ground. And this is the part that pushes us forward. And as we'll talk about later, what's really important is that we're really using our entire body to push or not entire body, but we're using our calf, our glutes, our hamstring. We're really using multiple muscles to push ourselves forward. And this is where a lot of runners get into trouble, because it's so much, we'll say, quote unquote, easier just to push off with our calf, which can lead to a ton of like Achilles issues, calf strain, posterior tibialis issues. There's just, and plus our calves are not nearly as big and strong as our glutes. So we'll talk a lot about how to maximize how well you can use your glutes in running. And it's going to make a huge difference in terms of efficiency and power. Okay, so I'm going to go over sort of some definitions here. I'm going to say these words kind of throughout the presentation, and I want to make sure that I at least introduce them up front. And I'll try to do my best to use sort of these descriptors so that you don't get lost in the soup here. But if there's anything that doesn't make sense, please let me know. So we're going to talk a lot about cadence. So you probably have seen cadence. It comes up as a metric on your GPS watch or your Apple Watch. And that's strides per minute. So it's counting each time a foot hits the ground. So that's both right and left foot. Stride length is kind of the maximum distance we're going to have between right leg and left leg in swing phase, right? So we got one foot that's going to start coming off the ground. And then we're going to measure as far forward as your swing leg gets. So that largest distance there is going to be our stride length. I think that's also a metric on a lot of our Garmin watches nowadays as well. Vertical oscillation is how much upward movement we get, so up and down movement. So this is telling me how much energy are we using going up versus forward. And so for a lot of runners, I will see too much upward movement and not enough forward movement because they're kind of, again, potentially overusing their calf and moving more up than forwards. It's more of a vertical jump versus a forward jump. If we think about running essentially as jumping from one leg to the other foot and repeating. Ground reaction force. So this is the force that is returned to our body with each step. And this is important because this is how much force our body has to absorb. I've seen a lot of different numbers out there, but with every footstep, we're putting about 7 to 8 times our body weight through our body, essentially. And so our muscles, our tendons, our ligaments, our bones have to be able to accommodate for that force. And so through our running form and through our muscular strength and the work that we can do, for example, in the gym, we can better accommodate for this force and even reduce it depending on what our running form looks like. And we'll get into some specifics with that as well. Ankle dorsiflexion is this is a typo here. This is the angle between the shin bone and the foot on the ground. So this is how far your shin bone can get forward when your foot is in a static position. And this is important because if we have good ankle mobility, then we are less likely to borrow range of motion from other joints, for example. And so this is something that we'll look at, particularly in that mid stance. So this is when that foot is passing underneath the body, and that's that sort of critical period that I was talking about earlier. And then finally, we have hip extension. This is how far the thigh can get behind us, sort of at that end part of the swing phase before you start to drive that leg forward again. So when we watch a lot of professional runners, for example, you see these really long strides with their leg gets really far behind them and they have what we call a high recovery. So that heel really comes up towards their butt. And so that is what we're looking at in terms of hip extension. And we'll see this in athletes no matter how fast they're running. But for a lot of these higher level athletes, we're going to see a lot of hip extension, which is considered a positive thing because it means that we're really using our glute to power that leg through. Okay, so here we go. So common gait deviations, and I put may in italics here because remember, all of this needs to be taken within context. And so it may be one problem for one athlete, but it may not be a problem for another athlete. And that's why all of this is really, really individualized. The other thing I want to make clear here too is that there's so many other things that can go on here. I've just kind of picked out the most common ones. So this isn't comprehensive. This isn't the end all be all. So just keep in mind that there are a lot of other things that can go on, but these are the ones I thought that was the most important to teach you guys tonight. What I really love about how I've set up this presentation is that we're going to go over what we see in running gait, and then we're going to talk about what exercises are going to be beneficial for that specific issue that we see. So I'm really excited because I'm hoping that this will help kind of tie all these things together to give you guys something to take home. Well, I guess you're all already home, right? But something to take and incorporate into your routine. Okay, so this is a very common one. A lot of the runners that I see have already seen this word, and we call it hip drop. So what we're referring to when we're talking about hip drop is this sort of inclination of the pelvis here. And so what this is telling us is strength for this runner, her left hip, her left glute. So specifically a muscle called the gluteus medius. And this is the muscle that is targeted by your side steps and your leg lifts and a lot of what we see as common band exercises for runners. And that's why they're oftentimes, they get the spotlight in the Runner's World articles and the blogs and all of this stuff, because we know that this muscle is really important. So the reason why this is a problem is you can see how this runner's back is leaned a little bit. So this makes the back muscles work a little bit harder and asymmetrical. Another thing we can see is that there'll be a lot of tightness here of the outside part of the hip, because you can't really, another disclaimer, all of these are static images, right? I thought videos would be a little bit too complicated. But the other thing I'm looking at is control of these movements, right? So even though we see this hip drop in static form, I'm also looking for how quickly it happens. Because if the runner is able to control their hip in single leg stance, so when they're on this left foot, if this doesn't happen too quickly, if it's not a super quick movement, I'm usually less concerned about it. So that's a whole nother caveat there. So how do we fix it? Hip and core strengthening, specifically of the gluteus medius. And I think a lot of like side steps, band exercises, I think those are great. But what I tend to think is a little bit more important is actually practicing the pattern, right? So controlling mid stance. So we want to use that glute to stabilize our pelvis while we're in a standing position. So if we are lying on the ground or doing like a clamshell exercise, for example, we're not getting that muscle to fire in the specific way we need it to. It's a great way to get the muscle strength started and get that muscle to turn on and to get stronger objectively, but we need to learn how to use it in a standing position. So I am really big on getting people to use this in a functioning position as quickly as possible. And of course, that's dependent on how strong they can get doing the other exercises. So this is an exercise I call a heel tap, or it's basically a single leg squat. This is my former coworker, Ryan, here. We're going to go ahead and start video here. So we're on a little bit of a step. I'm not really too concerned about height here. This is about 6 inches or so, 4 to 6 inches, I believe the type said there. And you can see that Ryan's really sitting back into that hip. And so here from the front, we want to keep the hips level, right? Because that's what we're trying to practice, is to avoid that drop. And then we want the knee to stay pointing forward. So what we'll see a lot is this pattern here where the knee dives inward. And that is the pattern we're trying to avoid, because what happens when we hip drop is the rest of the leg responds, and we'll see that knee diving in, which can be the root of a lot of issues. So we'll go through this one more time. So he's really sitting back into his heel, or into his hip here, and his knee is staying pretty much level with his toes or slightly behind his toes. So if you allow your knee to come forward, this is going to be a little more quad dominant. You're going to feel it more in your thigh than your glute. So when we're doing this exercise, you really want to feel this in that hip. So in the glutes and not so much the rest of the leg. And so again, we're seeing what we don't want to see, which is that knee diving inwards. So super simple, but has to be done very intentionally to be as effective as we want it to be. Okay, here's another one of my favorites. Again, we're really practicing mid stance here. So this time it's me doing the exercise. So I have a band just above my knee. I'm going to get into a position where my knees here are equal. Tibia is going to, or my shin's going to stay parallel, and I'm going to rotate my other leg out here. So what a lot of people are surprised about with this exercise is actually really targeting, for me, it is my right leg. So the leg that is in that mid stance position, right? So if we look at this again, so what the band is doing, and when I rotate my left leg out, I'm providing like an inward pull of this leg. And so I'm really having to use my glute and my hip to keep my knee from pointing forward and not diving in. And so trust me, this one's a real burner. It's going to get those glutes on fire pretty quickly. And so this band I have right here is pretty thick, but you can kind of moderate the thickness and the resistance of the band to a difficulty that's going to be successful for you. So we don't want it to be too light, because then you're not going to feel quite as much of the resistance as we're wanting to. And we also don't want it to be too heavy to where, for example, you can only do a few reps correctly. So this is one of my new favorites, and this is one that I like to really work people up to once they're able to control it properly. Okay, next, so overstriding. So this is what I was talking about earlier, where the foot at initial contact, so when we first hit the ground, that foot is hitting a little bit or a lot, depending on the runner, in front of the body, right? So if I really should have drawn a line here, but so this runner's center of mass is going to go straight through here, if you can see my cursor. So it's kind of straight through, like if we think of like where the hip joint is straight down, that is where our center of mass is. And we want this foot to hit as close to the center of mass as possible for the most part. And that's what we would consider most efficient when we're looking at running form. This is honestly not too bad. I was looking through all my gait videos. I didn't find one that was really severe. But I would tell this runner, like, hey, I think you should try to get your leg underneath you a little bit more, because that's going to take some of the stress off of the ankle, the knee, and the hip ultimately. So again, yes, this runner is heel striking, and a runner is more likely to heel strike when they overstride. But the heel strike isn't necessarily as big of a problem as the fact that this leg is so far in front of her and she's having to do all of this muscular work to control and bring her body over that leg, when if she just landed underneath her, she could just go. Hopefully that analogy kind of lands, but if not, let me know, ask questions at the end. So why does this happen? The most common reason is someone with a lower cadence. So I know a lot of you guys out there have probably seen the articles or read somewhere that 180 steps per minute is the ideal cadence. And yes, I would say that this is an average sort of goal cadence, or it's a good goalpost for us to have when I'm working with someone. Now, this is going to change. Ideal cadence is going to vary between individuals depending on how long your legs are, how short your legs are. In my case, for example, without trying, and my kind of default is about 190 steps per minute, which is pretty high, but it's the only way I go anywhere with my short little legs. So I do see a lot of people with cadences in the 155, 160-ish range, which I usually consider pretty low, and we try to bump that up a little bit to help them decrease that ground reaction force, so decrease how much force is going through their body, and hopefully get them to take not necessarily shorter steps, but to get that leg underneath them, because if they're having to move that leg over quicker, you're less likely to throw that leg out in front of you. So again, cadence is super individual. I wouldn't tell anyone on this call exactly what cadence to run. When I'm working with runners in the clinic, we take what they're doing currently. So if they're, for example, at 150 steps per minute, I never want to increase that more than 5%, 5 to 10%, depending on experience of the runner and things like that. But it's never something I want to go straight to 180. We don't want to take a runner who's hanging out at 155 steps per minute and try to get them running 180 steps per minute. So cadence is a tool we use a lot. There's a lot of studies on running cadence, and increasing running cadence does two really beneficial things for us. First of all, it decreases the ground reaction force, and oftentimes has been shown very beneficial for knee pain in particular. And the reason why is because we're more likely to land with a more bent knee, which the straighter our knee is, the harder a time we're going to have actually absorbing that force with our muscles, and all that force is going to go straight through the joint, for example. And then the other thing it does is it helps with glute activation. So particularly that glute medius that we were talking about earlier. And so two really beneficial things, and it's a really simple cue that can be really, really effective. The way I usually train this with people is there's several apps, phone apps that can set out a certain cadence for you. I use one that's called Pro Metronome. Usually it's like super simple to use. It is a little annoying to listen to the beeping, but it can give you that auditory feedback so you can feel what it feels like to have that little bit of an increased cadence. And it's the most effective thing that I can give people so that they have kind of that real-time feedback. And then there's also some drills that we can do. We're going to go over one drill that could be helpful for this particular issue. And this is one of them. So this is an A skip. So there's A skips and B skips. So if anyone here did high school track or something like that, you might have heard of these before. But I really like these because these work on, or what I have runners focus on when we do these is getting that foot to land underneath you. And so you'll see this kind of in the video. I think this person's going to talk, so I hope this isn't too loud.
A skip, I'm going to start with that one.
So I'm going to just mute him. We don't need to listen to him. We'll listen to me instead. So he's just kind of talking about the knee drive part and then moving into a skip, and then eventually you're going to be moving forward. So you can see how he kind of pulls that leg underneath him a little bit, and he's practicing getting that that initial placement of the foot to be right underneath his body. And so this is something I would give someone to do both pre and post run, so you can warm up that pattern and then also solidify it when you might be a little tired at the end of your run. So again, he's kind of skipping, he's using his arms and really driving that leg underneath him to help with his forward propulsion. Here's another big one, and a lot of times these two come together. So a lot of times we'll see an overstride with an upright posture or a backwards lean. And the reason is it helps counterbalance us, right? So if our foot is way out in front of us, the way we'll feel balanced and how we'll naturally react is to lean backwards. This is one of my big problems. A lot of people, if they see me running from afar, they can really pick it out because I for one, I have a very aggressive running form. I don't know why. I swear I'm a happy person. I swear I love running, but everyone tells me I look so angry out there, and I don't. But I have a really hard time with this. And so I'm very passionate about teaching other people how not to do this. So what is it? Again, so it's leaning back at that initial contact. So we can see this runner here. Again, this isn't terrible, but this is definitely an example of it. And this particular runner, we worked on forward lean and cued his forward lean, and it helped a lot with his hip and knee pain. So this is a really simple fix for us. So what we're looking for here is, so you can even see here where his back end is a little bit of extension here, so kind of that backwards bend. So that's what's telling me that he's actively sort of extending and kind of counterbalancing himself through here. And so this can lead to a lot of like low back, SI joint type issues, just because we're compressing all of these joints back here. And it also makes it really, really difficult for us to use our glutes here. So again, going to talk about glutes a lot. I'm pretty sure that that's most of my job as a physical therapist, is teaching people how to use and strengthen their glutes. But this posture makes it very difficult for us to do that. And so oftentimes this happens because of a core weakness, because if we're extended, we're kind of hanging out on, we're using joint closure. So we're using kind of the congruency of our joints for stability instead of actually using our muscles to hold ourselves in a certain position. So my big fix for here is cueing people. So teaching people how to forward lean, getting rid of any overstriding. So maybe using a cadence cue if we find that would be beneficial. And then working on core strength. So here's an example of both a drill and a core strength exercise. This is just a freeze frame here. This is my coworker, Elizabeth. Something I didn't mention at the top of this is I'm part of an amazing team of physical therapists. So anyone at Precision Performance and Physical Therapy is very skilled in all of these exercises and tips and tricks for getting you running as efficiently as possible. But this is my coworker, Elizabeth. And so what she's doing is working on her forward lean here. And so when we're talking about forward lean and running, we want to be leaning from the ankles. So we want the whole body to be leaning forward. This here, I tried to stop this at a point where it would be similar to where we would be with running, for example. She's probably a little bit more forward leaned than what we would expect with actual running form. But the point here is that she's trying to use her arms as little as possible to hold herself in this position. So she's having to use her hips and her core to hold herself there in this nice forward lean and straight posture. What a lot of people will do if they're weak here is they'll kind of stick their butt out here, or they'll rely too much on their hands for stability. Because what we're looking for is that ability to hold your body in a forward lean position as you run, obviously. So I think a lot of runners know that core strength is important, but don't necessarily know why. And my favorite analogy for this is the ladder analogy. So if you think about the difference between climbing up a solid metal ladder and climbing up a rope ladder, right? So solid metal ladder, everything, you take a step, everything stays nice and steady, you take your next step. So we have that foundation, right? Rope ladder, you take a step, the whole thing wobbles, right? And then you got to figure out how to take your next step. And so that wobbling is like if we had a weak core, right? So if we don't have the strong foundation to power ourselves forward with, we're going to get really fatigued because we're having to stabilize ourselves, and we're going to have to use a lot of muscles that don't necessarily want to be used over the course of 5K, 10K, marathon, however far we're running. So this is why we want to be able to train our core to do its job so that our other muscles don't get overworked, essentially. And so other core exercises I like, this is just sort of the exercise I picked because it's most specific to what we're talking about here. But I tend to like exercises that are either training you to hold a certain position. So something like a plank or a dead bug or a bird dog, something like that. Or something that's controlling rotation. So if we think about sort of the reciprocal motion of running, right? So we've got, left hand, right leg, and opposite, right? So we have to be able to control this rotation. So doing some rotational things like a paddle off press or something like that, or some more other of my favorites. Okay. Pronation control. So the big bad word in running is pronation, right? So pronation is not necessarily a bad thing. Actually, it's a good thing. So pronation is how our foot adapts to the ground. It gives us a little bit of flexibility and ability to adapt. I already said this, adapt to different terrain and things like that. If we had a rigid foot, then it would just be some sort of like block just hitting the ground, and we wouldn't be able to accommodate for different terrain and things like that. So it's a normal part of running gait. It's a normal part of walking gait. But we do see sometimes issues where the pronation goes too quickly, so it's poorly controlled, or there's too much of it. And this is a pretty prime example here where you can see just how much this runner is stretching that inside portion of the shoe and how much inward movement we're seeing. If we had this in video form where it was live, this is very, very pronounced how quickly this ankle moves inward. And so the reason why this can be a problem, or why it can cause injury, is so we're putting a lot of tension on the inside part of the leg here, and then we're compressing everything on this side. So you can kind of see almost how his ankle joint here is actually compressed on the outside. And then we're not seeing it too much here, but when we have poor control of the foot, we'll see the rest of the leg sort of spin inward. So that can lead to things like the hip drop and rotation that our body doesn't necessarily want to have to deal with. Our body really likes linear forces. So the worse control we have of rotation, the more force we put through our joints and tendons and ligaments and things like that. So why does this happen? So weakness of the posterior tibialis muscle. So this is the muscle, if you look at the inside part of your ankle and you can see that really visible tendon coming through the ankle bone on the inside part of your ankle, that is the tendon of your posterior tibialis muscle. And the posterior tibialis is sort of our natural orthotic, I like to call it, because that's what actually controls our arch height and controls how much pronation we have. So strengthening this muscle, both just strengthening it overall and then teaching it how to work in a standing position is really important. Okay. So again, with this comes both hip strength as well, because we need our foot and our hip to be able to both control mid stance, right? We already talked about the hip part. We're talking about the foot part now. And then our foot intrinsics. So our foot intrinsics are the muscles that are actually on the bottom of the foot. And these are the muscles that are unique to the foot. So these muscles start and end in the foot. They don't travel up into the calf. And these are, again, sort of like your natural support. And so when I see something like this, sometimes we will talk about orthotics or changing shoes. But regardless of what we decide of those two things, the main fix for this is strength. Because we can't necessarily think about controlling pronation. It's not something we can consciously do, but we can work on our strength and our neuromuscular patterning and our balance to improve what we see here. Okay, so this is my favorite exercise here for pronation control. And so what I have here, all of these exercises are to be done barefoot. In fact, I prefer for almost all strength training exercises to be done barefoot or no shoes if you're able to. And so I have a band wrapped around an object that's not going to move here. And I've kind of stepped out a little bit so that I have a decent pull from that green band. And so I start out here, I'm going to think about keeping my arch lifted, keeping my big toe in contact with the ground, and I'm just adding a little bit of movement. So I'm kind of tapping my foot back and forth. As I get better at that, I can add a little bit more of a running specific move into a little bit of more of a lunge position here. Again, the key here is that I'm trying to keep my foot as steady as possible. Then I'm going to flip around the other way. And so now the band is pulling me a different way and I can repeat the same exercise. Again, trying to keep my foot as steady as possible. So watch this one more time. So you can see a little bit of wiggle in my foot there, and it's okay if you wiggle. But the thing is you need to focus and be really intentional about trying to keep that foot as still as possible and trying to keep the weight evenly distributed throughout the entire foot. I really like to be able to get to this point of the exercise here because that knee bend and this little hip hinge that I have here is really running specific. And we can kind of work on that specific control that I was talking about earlier. And then, so another good one just for foot strength in general, these are pass arounds. So very similar idea with the foot. So I'm going to make sure that I have my weight evenly distributed over my foot. My knee is slightly bent here. Here I've got a 10-pound kettlebell, but you can use really any object. And so I'm focusing on keeping my foot as steady as possible as I pass that kettlebell around. And then I typically will go both clockwise and counterclockwise directions. One way to make this a little harder is to drive that knee up. So now I'm having to move the kettlebell up and over. And this is also a little bit more running specific because this again is sort of like that mid stance position. And you can see I'm not perfect, right? There's a lot of wobbling there, but that sort of repetitive correction is what gets my tendons and my ligaments to be able to know what that correct posture is in terms of my foot being solid with my arch slightly lifted and to avoid that inward collapse we were talking about earlier in terms of pronation. Watching this now, I probably should have retaken that video and done a little bit better, but that's okay. Nobody's perfect. All right, last little gait deviation here. So crossbody arm swing. This one is really simple fix. So what we'll see a lot is when we're looking at arm swing, we'll see people cross their arm across their body here. So this kind of imparts a whole rotation of the body and can actually throw off the lower body as well. So I find with a lot of athletes and runners that if we can get them moving their arms in more of a forward back motion, so pure shoulder motion, so from the side. So I want that arm to go back and forward here. That's going to make it so that there's not as much rotation for me to control. And we won't see as many wonky things happening at the lower legs because of it. So again, this can happen just because of habit, because this is how we've always run, for example. But the way I'll help runners sort of be able to make this correction is working through some thoracic mobility, so upper back mobility, and then anterior shoulder and pec tightness. Because if we have tightness here and we can't get that arm behind us, we're more likely just to stay here if that pec muscle is tight. So again, how we fix this is working on the shoulder and thoracic mobility, and then we can do drills where we are working on driving that elbow behind us, not anything exaggerated, right? But we want to get our arms moving in this plane versus in this plane. Here's a little exercise that I really like because it combines multiple facets of mobility. You can see I filmed this during COVID because I'm wearing a mask. This arm or this leg portion of it is totally optional. So I'm in a pretty aggressive position here. If you have tight quads or hip flexors, this could be a really good position for you, but it could also potentially be really tight. So if this is too tight, then you're just going to take a little bit of a smaller object here. So maybe like a step stool instead of like a couch or a chair, just so you're not as in as of an aggressive position here. And then so what I'm doing here is I'm using my dowel a little bit to help me rotate. So this is that upper back rotation that I was talking about. And we're going to get some nice hip mobility here as well. So I like bang for our buck exercises because we're busy. We're busy runners, we're busy people, and trying to knock out as many aspects of injury prevention as possible, I think is really beneficial for all of us. Yeah, we'll just kind of look through another sort of cycle of this. I'm squeezing my glute here and trying to keep my hips pretty steady and get all of the rotation from up here. You can tell I'm I was a little bit tight that day. Excellent. Okay, so finally, our last little bit about when to incorporate strength training and how to incorporate this into your life and your training schedule. So wouldn't be a presentation without Bob's swole dachshund working hard in the CrossFit gym here. And then on the right, this is my dog Ollie helping me out with some deadlifts there. So we've already talked through a lot of this, so we can kind of breeze through these parts. So strength training improves our efficiency. So the stronger we are, the less matches we're going to burn with running. It decreases our time to muscular fatigue. So it can mitigate form breakdown late in races or when you're tired, which is mentioned again down here. The big thing for injury prevention is that it increases the resiliency of muscles, tendons, and bone. So we're asking for so much from our body every time we go for a run, every time we even take a single step. So if we can make that whole system stronger and more resilient, we can handle more load and we can have a little more leeway with our running form, right? Because if none of us are going to have perfect running form, but if our body can accommodate for that force, we're less likely to get injured. And then in general, it's just good for overall health and bone density. So we know, especially women in particular, but as we all get older, we start to lose bone density, and strength training is a great non-pharmacological way to improve bone density. And I know we all just want to run. I get it. We all just want to run. We don't like strength training. We don't like to spend any more time on this than we need to. But we all have an injury bank account. This is how I think about it. and we can make deposits into the bank account. So strength training, our proper recovery, so sleep, right? Sleep and recovery, nutrition, all of that, hydration, and stress management in general, all help us increase our bank account so that we can make more withdrawals without getting hurt. And everything else is a withdrawal. So this includes training, life stress, any other choices you might make throughout your daily or weekly life that might hinder your ability to recover from training. And the big thing here is the more you plan on pushing yourself with running, the more important it is to push yourself with strength training. So if you're really going for trying to go up in distance, or you're trying to run a PR, or you're trying to get faster, you're gonna have to change your training, and your training is going to be more intense. So getting yourself that protection with strength training is going to be even more important. And the strength training has to be challenging enough so that it actually causes some sort of change. It's stimulus for change within the body. And this is incredibly individual. So if you guys have any individualistic questions, I'm happy to answer at the end here, because it depends on your experience level, both with running and strength training, and what you're familiar with. But it is the key, just like I had mentioned before, is that it has to be challenging. So it's got to be something that is somewhat difficult for you, because that's how we get stronger. It's the same thing with running, where you're going to challenge yourself to run further, faster paces. Your body's going to adapt to it. And then that's what's going to make you a happy runner on race day. And then the big thing I always say, the best exercises are the ones that you actually do. So I could give you, this is the best strength training in the entire world. This is the program that's going to get you there. It doesn't matter if you don't do it. So you have to find something that works for you personally. My big mottos, My big mottos with this are hard days hard, easy days easy, and then progress and modify your strength training for your phases of training. So what I mean by hard days hard is if you're able to, with your schedule, I want to put the more difficult strength training days on your more intense training days. So speed and interval workouts, tempo runs, hill workouts, long runs. If this isn't possible, I want you to make sure you at least have a day in between your strength session and your next quality session. So a day in between doing any of these workouts. And then our training is going to evolve a little bit depending on what we're training for and where we are in our season. So we're going to put a bigger emphasis on strength in our base phases when maybe we're not doing as much race specific work, and then getting to a good spot just to maintain our strength through our peak phases and for race prep. All right, we did it, gang. So contact information here again. We are a physical therapy group. We're one-on-one and cash-based company based in the Emory, Greater Atlanta area. Here is my email. So if you want to copy that down, it's just my name @precisionpt.org if you have any questions that we don't quite get to tonight. And then we've got all of our other social media links and everything like this here. And thank you guys. This was one of my longer presentations, so I appreciate you hanging in there. And I guess we can talk through questions now, Bob.
You bet. Well done, Kacy. Thank you so much. So gang, who has questions? Feel free to unmute yourself.
And I can stop you. Well, yeah.
Please post a website again.
Yes. Just precisionpt.org there. We've got our contact information, patient portal, and scheduling, and all of that information there.
Was that you, Cindy, or do you have a question, Cindy?
No question, sorry.
Okay, that's okay. This is your opportunity, gang. So I'm sure you picked up on Kacy is good at what she does.
Okay,
No question.
I injured my Achilles. What would you suggest that I do to strengthen it so I don't do that again?
Yeah, so one of the big sort of cornerstones of Achilles rehab and prevention is doing what we call eccentric heel raises. So this is a specific type of exercise where either on flat ground or on a step, you will rise up onto your toes on both sides, and then you'll switch over to just your injured side and lower yourself down nice and slowly. And so what this does is this loads that tendon and makes it more resilient to stress, and kind of helps remodel the actual connective fibers of the Achilles. Because what happens in like a tendonitis or Achilles injury is that the fibers get a little bit disorganized in there. And so if we load it in a nice linear fashion, they go back to being nice and parallel again. And that makes it more resilient to stress. So there's very specific parameters on that, but I would say adding eccentric heel raises and making sure that your ankle mobility and your calves stay loose is a good start to that. It can be a little complicated, but I hope that answers it a little bit.
Let's see, we have Heather asks, what do you recommend for patellofemoral syndrome?
So patellofemoral pain syndrome. So what this is is pain in the front of the knee, which is literally what translates to with medical jargon. And so a lot of times what we're seeing here is hip weakness, because we'll see that knee diving inward, like we were talking about through with hip drop and some of the other like pronation control type stuff. So I would do the exercises for those two specific ones to help with controlling that knee and making sure it's tracking nice and straight, because that more kind of twisting and inward motion we get, the more strain it puts on the kneecap and the front of the knee. So the big name of the game there is hip strength and then foot control.
What was the cadence app that you mentioned?
Pro metronome. It's let me see.
And this is just an iPhone app, right? Yeah.
Yeah.
So Mary, I would add, although Dr. Kacy also mentioned this, let's suppose your cadence right now is 160 and you want to get it closer to something like 180. You want to do that in baby steps, right? So, might not be bad to have a form and gait analysis done just to make sure that you're not overstriding and that sort of thing first. But then from there, maybe again, suppose you're at 160, working on increasing it to 164 and doing that for several weeks until it becomes comfortable, right? And just actually, it will eventually become your natural cadence. And then you can dial it up a little bit more and continue to increase it until you go out and your natural cadence is say 178 to 186 or something like that.
Yeah, the key is not to make any too drastic changes.
Right. Let's see. Caroline asks, any recommendations for someone prone to posterior shin splints?
Yeah, so posterior shin splints is another name for posterior tibialis tendonitis or posterior tibialis tendon syndrome. And so this is going to be, so all the foot exercises we talked about, all the pronation control exercises, and then in particular ankle inversion. So let's see, I'm going to try to pretend this is my shin and this is my foot. So these are the exercises where the foot is moving inward. So big toes here. So big toe is moving towards in midline. That's going to work all the muscles on the inside part of the shin, which is where that posterior tibialis is. So those are for anyone who's prone to those sort of things. I think doing that ankle inversion band exercise is really important. Kind of kicking myself. I really should have put that one in the presentation, but that's just a simple band exercise that I find really, really effective for that.
Anything else, Caroline?
No, thank you. That'll be really helpful, I'm sure.
Yeah,
You're welcome.
you're welcome.
Allison, what is the name of the kettlebell around? Does the exercise with the kettlebell around the hip have a name? I think you call them wraparounds.
Pass around. Yeah,
Pass around.
pass around. Yeah.
Pass around.
Yeah, pretty simple name there.
To the point. Yep.
The point. That's all right.
Susan asks, do you recommend that any upper body training also be done on the hard run days? So full body strength training on same days as hard run days.
That's a great question. I would say it's a little bit less important. So if you are someone who is familiar with strength training and you're kind of splitting your days up between upper and lower body, I think upper body can be a little more flexible and you can kind of put it wherever you need to, because it's going to be less taxing, and less likely to affect your running as a whole. So that one you can be a little bit more flexible with. I just definitely wouldn't put it on like a planned rest day, because that's why it's called a rest day. No training on rest days.
Leg strength training before or after the hard workout, Kacy?
So this depends on what phase of training, right? So if we're in more of a base phase where the strength is more important, you can kind of put it either before or after. But I mean, if you're in your peak training and you're starting to do your really important speed workouts and very specific workouts, I would recommend doing them after. I personally always prefer to do after, and I found that it works for me. And I get that, you know, sometimes it's hard logistically, but I would say as a general rule of thumb, I always say to run first, because most of us are runners and that's our priority.
Good answer.
Thank you.
Cindy, could you repeat what you said about time between strength training and run days?
Yeah, so if you're unable to do your strength training and your hard workout on the same day, I want you to at least have 1 day of recovery between a strength training workout and a speed workout. Did I say that right? Strength training workout and a speed workout. I want at least 1 day in between those. So let's say if your speed workout is on Wednesday, you can strength train on Monday or Friday, because you have a day in between there. I don't want you strength training the day before or the day after, because it's going to inhibit your preparation for the workout. And then the day after, it'll inhibit your recovery.
What's your IG handle?
I typed it in there.
Oh, did you?
Yeah. Debbie's got the correct one though. Yeah, it's precisionpt_ATL.
Okay. IT band strengthening exercises.
So again, IT band is a knee injury, and a lot of times, so the knee is kind of our hinge joint, right? So it just goes, it kind of opens and closes like a hinge. It can only go forward and back. So it's really at the mercy of the hip and the foot, because we have so much more leeway and so many more planes of motion to control there. So doing the hip and the foot strengthening and really controlling that knee in that way we were talking about. So doing all the standing exercises, making sure that everything is aligned, the knee isn't caving inward, and we're controlling the foot is going to be really important. So a lot of hip strength, a lot of foot strength for really any knee condition. But of course, importance with IT band is a lot of times there's a lot of tightness on the outer part of the hip. So working through hip mobility, and working through any kind of like tightness of the quad can be helpful as well.
Beautiful. Who else? I have 8:34.
Sorry, I got a little excited tonight with my new
Oh no, it was fantastic, Kacy. Well done, well done.
Great.
I loved it, for sure. Do you have something, Leroy?
I do.
What do you got?
First of all, I'd like to say that the lecture was super fantastic, and I think the length was great. Now, my question is though, I did run track back in high school, but many years have passed now, and I'm sure that I have developed some very bad forms. So, would you accept a video analysis of my run gait?
Yeah, so we do virtual gait analysis that is exactly that. We ask the client or the patient to take videos from the back, usually on the treadmill, on the back and from the side. And we go through the entire analysis of it, exercises, everything that we think that will be helpful, which is really a great tool to have. Of course, the downside is that we don't get to talk in person, but the positive thing is you can still we can like talk back and forth about what we see, and if there's any questions that arise, we can do it. But we do virtual gait analysis, and you can find the information on our website.
Thank you very much.
Yeah, you're very welcome.
The video needs to be recent, Leroy. It can't be from back in high school.
For sure, Bob.
Who else? All right, all right. I'm going to stop the recording.